As the debate over national health care reform takes shape, many legislators are looking to Massachusetts as an example. The state has succeeded in increasing coverage dramatically in a short period of time by mandating health insurance for all residents. In fact, both the current House and Senate bills would institute fines similar to those imposed on Massachusetts residents who choose not to purchase one of the state-sanctioned health care plans. When Beverly Flaxington, a Massachusetts mom of 3, did the math, she found that none of the state-approved healthcare plans fit into her family budget. So instead, she pays the fine.
To write a check for $1,500, which is, as I like to say, just take a match and burn that money because it's for nothing.
Beverly and her family actually do purchase health insurance. For years, they've been covered under a catastrophic plan from Midwest National Life Insurance. But their catastrophic plan is not on the state's approved list. So in addition to paying out of pocket for most care and prescription drugs, they also pay the fine.
If you look at what we paid out of pocket for insurance and what we paid out of pocket to cover our doctor's bills and the penalty, that still is less money than if we had paid for the insurance on one of these other plans.
People who decide to pay the fine instead of buy insurance are typically individuals who either really don't want to have any coverage and would rather pay a little amount in the fine versus the entire premium. That's generally speaking a relatively small number of folks. In Massachusetts, less than 5% of people don't have coverage, and of that, only 20% were charged the fine. Some were deemed to not have access to affordable health care, so they were exempted from the mandate. But by and large, at least in Massachusetts' experience, the mandate was very successful at increasing coverage rates for individuals, and the fine did affect a few.
We are very big on preventative care, so we spend a lot of money. We go to the chiropractor, we go to the acupuncturist, we use homeopathic care, and honestly for our family it's worked very well. My kids have been cured of allergies, and so we actually don't use insurance and don't use doctors very much. So we just felt for us to pay more money for something that we really wouldn't use didn't make a lot of sense.
President Obama has made it clear that he wants all Americans to have health care, but at the same time, the government can't pay for coverage for all. Instead, uninsured Americans will be required to purchase their own coverage, often with federal subsidies. Just like the prospect of a speeding ticket can encourage safer driving, the health insurance fine is intended to encourage compliance with the mandate.
You're trying to balance two things. On one hand, you want the fine to be big enough to encourage people to buy insurance. If the fine's too low, the mandate becomes meaningless. On the other hand, if the fine is very high, individuals that really don't want to buy insurance are forced to pay a lot of money for nothing, and you don't want those individuals to complain too loudly. And I think in the case of Massachusetts as an example, by starting it low, you get the system rolling, and then you give people time to transition into buying it.
Next year, Beverly could be in another bind. Her family's catastrophic insurance plan might no longer be available to Massachusetts residents.
This insurance company that I use and have used for years and years is getting basically pushed out of the state, so that there will be no outside insurance company. So next year, my only choices will be these very expensive plans that technically I can't afford, and even the Massachusetts website, the Health Connector, says I can't afford them. It says, you are considered unable to afford the health insurance that is available to you. It's as if when my car with 134,000 miles on it, I'm gonna need a new one at some point, if all of a sudden Massachusetts decided they knew what the minimum creditable car would be for me. It's like if I walked to the lot and they said, here's the Mercedes-Benz, here's the Jaguar, here's the BMW. And I said, but I have a 6-year-old and she spills stuff. I don't want that kind of a nice car. I have to buy the BMW of insurance, but I don't need it and I don't want it and I can't afford it, but I'm going to get forced to buy it anyway.
After a tough year financially for her family, Beverly is now working with an accountant to see whether she might be exempt from paying the fine next year. And she already has other plans for that money.
You know, $1,500, I'd love to put that in my kid's college account.